Okay, so we're coming back from the break. I'll just look up who's coming up next. So yeah, so we're gonna have one of our own YAHPA members. It's Tianxi Wang, who's gonna talk to you about doing research in the healthcare field.
Hello, can you hear me, Natalie?
Yeah, it's good.
Great. Hello, everyone. My name is Tianxi, and in the next few minutes, I'll be telling you all about careers in health research. So just a little bit about me. So I got both my bachelor's and master's degree in science, majoring in human physiology. For people who don't know what physiology is, it's basically the study of how normal organ system function. And I started doing some research during the third year of my undergraduate degree. I started from just simple volunteering and then did my little, independent research project, undergraduate research project. And then during my master's degree study, I worked on the disease mechanism of a rare inherited cardiac disease called the Lung-QT syndrome. So I graduated in May 2020 during the pandemic. And since then, I've been mainly working in the industry. You can see that I listed 4 companies that I've worked at. The reason why there's so many, it's because some of them are internships. And I won't read every single one, but basically what I've been doing in the industry is still a lot of research in different disciplines, as well as a lot of scientific writing. Next slide, please. Okay. So I don't know how many of you have heard about or is interested in health research. I just wanted to tell you that it is a field with the potential to save countless of patients' lives without having to physically care for any of them. And what you do every day is to look for ways to prevent, treat diseases, solve issues in the healthcare system, or just try to improve the delivery of healthcare so that your patient can benefit more from it. So I'd say it's an indirect healthcare field, but it's a very powerful one. And I'll just briefly cover how research works. So if you look at the circle on the right, you always start with an observation or a question. For example, does drug A help lower patient's blood sugar? You wanted to know. So, and then the first thing you do is you look up what people have already done at this point. You go to the library, or many of the literature right now is online. And then you come up with an educated guess of what you think it is. For example, you think, oh yeah, I do think drug A can lower blood sugar. And then at that point, sorry. Thank you. And then you have your hypothesis, and then you can do the fun part, which is to design your experiment. You buy all the test tubes, all the reagents, play with them, do a nice little experiment. You can do it in tissues, you can do it in animals. Eventually you get to do it in humans. And then you come up with data. Like, for example, you collect the blood sugar level from cells, the sugar level from cells that you use drug A versus you didn't use drug A, and then you compare the level of sugar. And then you come up with some nice data. And then the last part is to report that data. Usually in health research, we do this in the form of scientific publications. You publish on journals, or you can travel to conferences to present your finding to the world. And at this point, your circle continues. You ask a new question, but you just, like, as a researcher, you just continue down the circle. But what the piece of knowledge you've contributed to the field have a series of downstream impact. Like if you look at the arrows on the left, your publication, your paper might be read by other people, other researchers in your field, might be read by doctors, pharmaceutical companies. They might take an interest, they might agree with you, and then they can start mass producing drug A, and then move it on to test it in patients. And then after that point, your drug can eventually enter the market, and then it can reach your patient, and then patient can take them, and then their blood sugar gets controlled, and then you've saved lives. And then somewhere at this point, you probably will also receive a Nobel Prize, but that's not guaranteed. Next slide, please. Oh, next slide, please. Thank you. So although my background is kind of in, it's very clinical, I've studied a disease, I just want to tell you that fields and careers in health research is very diverse. I've roughly divided them into 4 categories, just to give you a general idea. You can do basic or biomedical research where you will investigate some of the most fundamental problems, like how does a heart pump work? Why do someone gets heart attacks? Like these fundamental questions are handled by biomedical research. And in these categories, you normally deal with cells, tissues, you raise cute rats and feed them poisons, sorry. Anyways, you work in a lab, okay? And then the second category is called clinical research. This is where you get to have some direct patient interactions. It usually involves human subjects, and then you're testing whether a drug is safe. Like you already have your drug, you're just testing whether it's safe or effective in humans. And the research goal in this category tends to be more practical. You're trying to help prevent, treat, or directly diagnose diseases. And then this type of research is typically done through the form of clinical trials, which I think you might have heard. And thirdly, you can do some health policy systems research. This is, I would say, not, it's a multidisciplinary field. You're not strictly doing science or medicine anymore, but you're looking at how to improve the efficacy and effectiveness of the healthcare systems. You're looking at how much healthcare costs and how to make it better, how to make a hospital more organized so that patients can get like shorter wait time, stuff like that. I would say, yeah. And then lastly, you have populational and public health research. This is again a multidisciplinary field. You're looking at how to, like, the questions you'll be investigating would be like, as a society, what are some measures we can do to improve the health of an entire population? An example of this would be the COVID vaccine measures, I would say. And I want to highlight that in this field, you're also looking at some social determinants of health. Okay, next slide, please. So one of the distinguishing features of health research, what separates it from other healthcare fields, is that you can enter the workforce at various points. You can just get your Bachelor of Science degree, which takes 3 to 4 years, and then you can start working. Or you can move on and do a Master of Science degree. This is where you will actually that's where most people get to work extensively and independently on an actual research project. And it usually takes 1.5 to 3 years. And then after that, there's an opportunity for you to fast track to PhD programs, obviously, or you can enter the workforce after. And next, you can do a PhD. It will usually take 5 to 7 years. And the training phase is so long because you get to develop highly specialized knowledge and techniques on your area of study. If you get a PhD or above, such as postdoctoral studies, you're generally considered an expert. Okay, next slide, please. So where can you work as a health researcher? So the most common place that I think people go to work is universities and research centers. On the top left, you can see where I used to study, the Bellini Life Science Complex at McGill University. And there's a photo of my bench. I'm a very organized person, just kidding. And there are also a lot of labs at hospitals. So if you want to interact with other healthcare professionals or like work directly with patients, you can pick a lab that's at a hospital. Or if you work on clinical trials, you will see patients in medical offices. And of course, you get to work at pharmaceutical or medical device companies. That's also that's where a lot of us work as well as health-related charities. I worked at the Heart and Stroke Foundation, and because in these healthcare charities, you don't really do lab work anymore. More like it's more for public health or health systems research or like scientific writing. And you can even work at business or consulting firms and many others. You can be a freelance science writer if you want. So there's really a lot of places you can work. Okay, next slide, please. And the type of jobs you can do as a health researcher. Okay, again, I think I'm not going to go through every one of them. This is just for you to look through and see if there's anything you're interested in. But as you can see, there's many different types. It ranges from being a lab assistant, technicians, to lead investigators or like various leadership roles. And I also want to highlight the others category, which is what not a lot of people think about. You can become a consultant, such as working at Deloitte, that's what you want. You can be a clinical business analyst. You can be a medical scientific writer, or a lot of us have become a data scientist or biostatistician. Or you can, if you have the artistic talent, you can become a medical illustrator. Those are various ways you can contribute to the health of a patient. And some factors to consider when you choose your career is first, whether you want to actually see patients. You can choose to have direct patient interaction if you work in clinical trials as a clinical research coordinator or clinical research associate, or you can just work in the lab all the time, like lab assistant, lab technician. And another thing to consider is whether you want to lead your independent research project or you want to support someone else's research. If you do want to lead, you will need to, I would say it's safe to say that you will need to at least get a PhD degree to really get the exposure and learn the skills to lead a project and to like form educated, good questions. And you can also coordinate projects. This is mainly, you can become a lab manager at a lab, or you can become a research coordinator for clinical trials. Another things to consider is whether you're a hands-on person or a cerebral person. If you really like to get your hands wet, you like to do experiments, you can choose fields of study that allows you to do that. If you're more of a cerebral person like I am, I've chosen to develop myself in scientific writing instead of conventional research. That's something you can do too. But typically, the more advanced degrees you get, you typically get higher levels of autonomy, you have more responsibilities, and then you also make more money. Next slide, please. Okay, so this is what I just wanted to give you like a general idea of what your day may look like. This is actually my friend. She is a junior cancer health researcher working at a pharmaceutical company. Her hours are 9 to 5, your standard hours. But I just want to say that if you're in grad school, you have a poorly defined hours. You might come in later, leave later, and the hours are typically longer when you're in training. So what she does is that she carries out experiments in cells and in animals to test drug candidates to see whether they can shrink cancer or whatever she does. And then because she is an independent researcher, she also designs her new studies, figure out how much time she would need, who can help her to do these experiments and prepare. And then she takes some time to analyze her results, discuss them with her colleagues and supervisors. And then she also needs to figure out what kind of supplies, what kind of drugs, what kind of tubes, what kind of cells she needs, and then she needs to order them. And she needs to maintain her workstation to make sure everything's good. And then she attends quite a few weekly meetings. I want to mention that during training and during working, you get to develop your public speaking skills because you will have really regularly data discussion or progress meetings. And then she reads some literature to keep herself updated on this field. Okay, next slide, please. And lastly, I want to just briefly talk about some pros and cons. I know we're kind of running out of time, but I won't go through everything on the list, but well, I think the most important significant pro is that it is a fun field. It's exploratory. You get to investigate things that no one knows the answer about. You don't know what to expect. That's kind of fun. And then you get to play with reagents. But I guess the flip side of thing is that it can be a lot of work. It can have really high stress. My friend described that if 0 is at a spa vacation and 10 is on the losing side of a war, your average stress level is probably an 8 because your result can be unpredictable. You're being continuously evaluated on your performance. These can, induce a lot of stress. Some other pros is that you get to become an expert. Your findings can impact patients' life, as I mentioned before. And also, I hope you already know from this presentation that your job prospect is really good. It's really diverse and you have a lot of freedom to choose. And the flip side of that is that you have a really long training path. You know, a PhD degree is like can be up to 7 years. And then because of the diversity of jobs you can pick, there is really not a standard pathway you go into. And lastly, I just want to mention, inevitably, sometimes you wonder what you're doing with your life, especially when your research project isn't going well. And sometimes you don't know whether you're because you don't really see the patient you're helping with your research. So, you know, some like during late nights, sometimes you can have these thoughts, but I don't think they're unique to health research. Well, that's it. Let me know if you have any questions.
Thank you, Tianxing. Someone's asking, two questions, okay. Is finding a job easy and what's the average salary?
That's a good question. So finding a job generally, it depends on what exactly you study. If, for example, you do clinical research, there's a lot of funding, it's a rapidly expanding field, you have an easier time finding a job. I would say for my researcher friends, on average, they can find a job within 2 or 3 months after they graduate. It's difficult to give it one answer because it's so diverse. And job salary, it also depends on what type of research, what type of field you're in. But if, let's say, take the example of my friend, junior cancer researcher in a pharmaceutical company, if you graduate with a bachelor's degree, you're going to start at the very bottom at around maybe $40,000 per year. And if you have a master's degree, you're probably starting at around, you can expect around $60,000 or above. And then at your job, you're also doing a slightly higher level job than undergrad, than bachelor's. And if you have a PhD degree, they usually start around $80,000. Sometimes it can go up to $10,000, depending. I should say that it also depends on your experience, how many years you have spent doing research, doing experiments. And I should also say that private companies, biotech companies, usually pays higher than academia. Yeah.
Another very interesting question we have is, did you always enjoy doing lab work, writing reports while you were in high school or CEGEP?
That's an interesting question. My mom herself is a researcher, so growing up, she kind of predisposed me to that. But I would say I actually, during high school, I found the science courses to be quite boring, to be honest. I think the part I liked the most was really when I started volunteering in the lab during the 3rd year. I worked at an immunology lab. It's my first time, you know, actually doing like, I shouldn't say real, but real research. That's when I started to like it. Okay, I see one more question about toxic elements in the work environment. Again, it depends on what you do. If you do more biomedical research with, for example, the lab that I worked at, there are quite a few toxic elements, but we have really strict rules like personal protection equipment before we get close to them. So there is a possibility, but it is, well, if you take the precautions, it shouldn't be a concern. Yeah.
Thank you so much. I think that's it for the questions. If you have any more questions, you can message us on YAHPA's different social medias, because Tianxi is one of our members actually. So I'm gonna let our next speaker in. It's someone who's a general dentist. It's a Dr. Clément Fong.
Hi, can you hear me?
Yeah.
Okay, so I'll present myself quickly. So my name is Clément Fong, and I'm a general dentist. I'm currently working in a private clinic in the South Shore, Montreal, in a clinic called Clinique Dentaire Le Sommet in Saint-Hyacinthe, and I'm a new graduate. So I only graduated this year from the University of Montreal, and I started working in July of last summer. Next slide, please. So the general description of someone with a doctor of dental medicine is someone that is specialized in diagnosing and treating any diseases within the orofacial area. So this can go from the mouth all the way up to the temporomandibular articulation and where you open your jaw. So it includes the teeth, the oral mucosa, like the gums or the tongue. So example of diseases that you'll be diagnosing and treating are dental caries. It can go to dental abscess if you have infection of the tooth. And it can also be periodontal diseases. So if you have an infection or an inflammation of the gums. And there's also some patients that have edentulous problems. So if they're missing some teeth, we will have to find ways to replace them. And there's also some pathologies that we can see in the mouth, such as cancer or other diseases that we'll see on the tongue. And when we diagnose that, we usually send those patients that have cancer to the hospital so they can get treated for that. Next slide, please. So for the courses and duration, there's 3 universities in Quebec that offers this doctorate. And there's University of Montreal, University of Laval, and McGill's University. And so aside from University of Laval, the other 2 university is a 5 years program. And for University of Laval, which is in Quebec City, they offer the program in 4 years. I also put the number of spots for each university so you have a general idea of how many places there are. But as you can see, usually there's a little bit more places at University of Montreal, while McGill University have a little bit less. Next slide, please. So I was asked to talk about the ease in finding a job. So as a general dentist, it is a job that is still high in demand. For me, it was really easy to find a job, especially if you are set to work in suburbs, so 10 to 15 minutes from the island of Montreal. There's plenty of dental clinics that are searching for new dentists to work with them. But if you want to work in Montreal downtown, it is also a place where you can easily find a job. But it is more frequent that you will have to do the job in 2 separate clinics. So around my colleagues or my friends, and most of them will be working in 2 separate clinics, doing like 2 days in one and 3 days in the other one. And for my personal experience, when I was in my last year of dentistry, there were some dental companies that usually sell equipment to the dental clinics. They organized this networking event over Zoom. And basically all the owners of the different dental clinics that were trying to look for new dentists to work with them, they went to this event and start presenting the clinic, what type of patient that they see more and what type of technology they use. And after this event, I was able to apply at 3 different dental clinics, all of them in South Shore of Montreal because it's more near where I live. And I got interviewed at all 3 of them, and all 3 of them were wanted to offer a post at their clinic, but I was able to choose which one I was more interested in. Next slide, please. So the reason why I chose this job is because it's a job that is a lot of hands-on. So you're always working with your hands throughout the day. So it is really stimulating. You won't have time to get bored during a work schedule. And you also have a really stable schedule. So since you're a general dentist, you are a self-employed employee, so you can choose your own schedule. You can talk with the owner of the clinic or discuss with the coordinator, and you can make your own schedule. So if you want to work 3 days per week, 4 days per week, you can do this. It is also a well-respected healthcare job, and when you do treatments on patients, you can see clear result of your intervention. So this is also a good thing for this profession. Next slide, please. So a workday example for me, for my schedule, I chose to work from 8 in the morning to 6 at night. So it's a 10-hour shift. And usually during a workday, I will see around 10 patients per day. Those 10 patients that I'm seeing are the patients that I'm actually doing a treatment on them. So whether it is a restorative treatment or I'm doing a minor surgery like tooth extractions, but at the same time, I'm also supervising 1 to 2 hygienists. What does this mean is that while I'm doing those treatments, sometimes I will have to leave my operative room and go to my dental hygienist room and see the patient that they're seeing so that I can do a full exam of their mouths and I can come up with a plan of treatment. So the patient will know what's the next step for them and if they need to take an appointment for another treatment or if they can just come back after 6 months for a follow-up. And as you can see on the left column of the picture, this is my schedule and the time slot that I get per patient changes depending on the type of treatment I'm doing. So if I know that it is a treatment that will require more time, it's a bit more complicated, we will book the patient for an hour and a half, while if it's some treatment that we know is going to be easy, we can book them for 30 to 45 minutes. Next slide, please. So the pros and cons of this profession. So the best aspect of the profession, since you're a general dentist, you have a lot of independence in practice. So depending on which branches of dentistry or which field you like more, you can shape your practice towards this direction. So for example, if you're someone that really likes surgeries or doing restorations on teeth, when you're trying to look for the clinic that you want to work with, you will try to find one where the patients that they have will be more towards the field that you want. And as I said earlier, since you're self-employed, the schedule is really stable. And even when you want a vacation, for example, you want a vacation in 2 months, you can just speak with the coordinator of the clinic and they will be able to close off this week that you want. And you basically just have to tell them a lot in advance so that they don't have patients already booked during those weeks where you want a vacation. And another good aspect of the job is that there's a good salary for this, and you can also get a lot of gratitude from patients. So if whether a patient is coming for some aesthetic work or they have a toothache and you manage to solve their problem, usually you can see a lot of gratitude from them. The bad aspect of the job is that there is some patient that will underappreciate what you're doing because they are not a lot of people like going to the dental clinic because they often associate it with an experience that is painful or unpleasant while you're only trying to help them. So in the end, for those patients, you only have to try to talk them through it, try to calm them down, and just guide them through the procedure. There is some level of stress, so like you saw on my schedule earlier, all my patients were booked back to back. So you kind of have to be really good at managing your time because you always have to finish your treatment within the time slot that they book for you. Otherwise, if you have like a delay on your schedule, the next patients will be waiting in the waiting room. And in the end of the day, you still have to find a way to go through all of the patients that were booked. So this is one challenge that you have. And also, since you're supervising 1 to 2 hygienists, when you're doing a treatment, you have to find some breaks that you can take between steps of your treatment, so you can leave the operative room, so you can go to the see the dental hygienist, and then come back to your room to finish the treatment. And and there's also posture and back and shoulder pain or soreness. So at school, they will always teach you the best ergonomy to work. Like you have to sit 90 degrees, have your elbows close to your body. But in real life, it's not always possible because there's always some different conditions that doesn't allow you to work with this posture. And for example, if some patients they don't open wide enough, or we can't lower the chair enough because they also have some like back problem, then you always have to find a way to see what you're doing. And since you're working in the oral cavity, which is a pretty small space, you have to be good with your hands. You have to have a good dexterity, but you also have to bend yourself in a certain way so you see what you're doing and when you're doing the treatment. So this, at the end of the day, if you have a few patients like that where you don't work in a good position, you do get back pain or back soreness. And last but not least, there's also some patient with unpleasant hygiene. This happens with the job, and after a while you get used to it and you'll see all sorts of things, but it does happen. Next slide, please. So there's different domains within the profession. I put all of them, but I won't go through each one in detail. But it's basically to say that as a general dentist, you can touch a little bit of each branches that you want, but it's up to your level of comfort and up to the level that you learn. For example, there is some stuff that overlap. You can do some treatment that the maxillofacial surgeon does, like extracting wisdom teeth, but you can't do like any of the major surgery that they do because they do like a 5-year specialty after general dentistry to become a surgeon. So for example, they will be able to do advancement of the mandible if it's retruded, but this is usually done in a hospital for major surgeries. But as a general dentist, you would do like the minor one, the one that you actually learn at school. Next slide, please. And here are the other professions that are related to general dentistry. I mentioned hygienists a few times already over my presentation, and their job mainly consists of doing dental cleaning for the patient, taking x-rays for them, and they usually also do a quick assessment of what they see in the mouth so that they can give you a small report before you go and see the patient, so you kind of know what you're going to see, what you're aligning yourself to do as a plan of treatment. There's also the dental assistant. They're the one that work the closest to the dentist because the 10 patients that I'll be doing treatment on them, I always need my dental assistant to be next to me because they'll take care of handing me the instruments that I need. And they also take care of suctioning the blood or suctioning the saliva. And for example, if I'm doing a surgery and I need my 2 hands for the sutures, they will be able to retract the teeth and the cheek for me and suction the blood so that I can see what I'm doing. And the dental assistant also take care of sterilizing the instruments that I use. So I'm preparing the room for the next patient that I see. And the last profession that is related is there's laboratory technicians. So if we're doing some prosthesis for patient, such as dentures, we usually work closely with the technicians because we will take the impression for the patient, take all the measurements that we need, and we will send it to the lab, and they will be the one confectioning the prosthesis, and they will send it back to us, and we'll make sure that it fits in the mouth of the patient. And if ever there's some adjustment that needs to be done, I will usually be the one doing them. But if it's not able and we can't do it on the dental chair, then we will send back the prosthesis to the lab, and they will fix it for us after we take new measures. So that's all for my presentation.
Thank you so much. I'd like to know if there's any difference between what you imagined the job would be as a student and what you found it, what your experience has been.
And there is some little difference because when I was at school, a lot of the techniques that we were using is more the basic type of like the old-fashioned way of doing things, kind of. When I started working in a dental clinic, for example, the impression that we take usually at school, it was more with the paste that we put in mouth, but usually now in dental clinics, we usually work with like technologies, and we will take like impression with a scan machine, and it will be in 3D, and everything is a lot smoother this way. So this is one of the major changes that from school to private clinic.
Okay. Someone's asking, are you planning to open your own clinic? And do you find it challenging since it also requires some business skills?
For opening your clinic, yeah, of course you will need to have some business skills because you have to manage the staff that you're employing. You always have to make sure that everyone is happy. And it's a lot about the management that you don't learn about. And usually, like, if you want to open a dental clinic, you will have to either take some courses and formations on how to do that. And personally, for me, it's not in my plans for the next few years. If it's later, I'm not sure yet.
So there's a question related to that. Like, in your experience, how many years would it take? Like, how many years of practice would you need before you feel confident enough to open your own clinic?
Um, I would say a good like 5 years at least before you're confident, because right now for the clinic that I chose, I work with two other general dentists, and if I run into some problems or some stuff that I don't know, I can always ask them. And so I think it does take at least well, depending on your level of confidence, I think for me it will take at least 5 years of experience before I want to open my own clinic.
Okay. Are the studies extremely challenging?
Yes, the study is quite challenging. I had semester that we will have up to 14 courses, and the hardest part is more around the third year of dentistry. You will have a lot of courses that are lab work. So a lot of those projects you have time during your courses to do them, but you don't necessarily finish them over the course. So you often have to stay after school at the lab to practice, or even for exams, for lab exams. If you practice a few times, sometimes it's not enough to feel like comfortable to go to the exam. So you will stay after school to practice in the lab. So that was the hardest part about the courses.
Okay. Are there any personality traits that you find are better fit for this job, or some personality traits that you would say maybe don't go into dentistry?
You have to have a lot of patience because some of the stuff you're doing like is really detailed. So you have to, when you're learning about it, you have to do it a few times over and over so that before it's good, and you have to have a good attention to detail as well, because since you're working in a small oral cavity and you're drilling a tooth, for example, sometimes there's a difference between 1 to 2 millimeter. So there is that you have to be good with. And I would say that someone that is not afraid to work with a lot of dexterity will be more fit for this profession.
Okay. When did you do the dental aptitude test before applying to university?
For me, there was I did the test in November. So there's from I don't know if it's still the case for now, but back then when I did the aptitude test, there was two times per year that we could do it. So it was either November or February. So for me, I did in November.
A question more about the lifestyle that you have as you work.
Okay.
Would you feel comfortable taking a lot of days off for traveling, for example?
Yeah, I will be comfortable. There's no reason to not take days off because none of the well unless you're seeing a patient where you need like you did a surgery and you want a direct like follow up with the patient a few days after. Usually the case is that most of the patient you don't really need a close follow up, so it doesn't really matter in that sense. So you can take a vacation, you can take days off for vacation. And sometime when you work in a private clinic, there's still like other general dentists are there. So if there's any emergencies for treatment that you did, they can always book it with those dentists.
Okay, thank you. Are there any last things you want to say to the people here, or if there's any more questions, last questions? before we continue?
For me, I'm good. And
okay, thank you. Thank you very much for your time.
Okay, thank you.
And if any of the people here have any questions, you can always message us, as I said before.
Okay. Right.
Okay, our next speaker is an optometrist whose name is Ariana Ceballos.
Hi, everyone. Thank you so much for inviting me. Good. Okay, so I present myself. My name is Ariana Ceballos, and I'm an optometrist. I've just graduated in June 2021. So you can go to the next slide. Perfect. So I'm just going to speak a little bit with my educational background. So I completed my CEGEP degree in sciences at John Abbott College from 2014 to 2016. Then I got directly into optometry. I completed my Doctor of Optometry degree at University of Montreal, the School of Optometry, from 2016 to 2021. And then now I'm currently doing a residency in community optometry, which is 1 year postdoctorate certificate. And I'm also starting working in a private clinic in the West Island. So since August 2021. Perfect. So what are optometrists? So we are the primary healthcare professionals for the eye and visual health. So we provide eye exams and vision tests to detect, diagnose, treat, and manage some visual disorders and eye diseases. By visual disorders, I don't necessarily mean only seeing blurring for far, for near, but it's also everything regarding binocular vision, like double vision, neurological disorders, dry eye, and all the eye diseases as well. We also prescribe corrective glasses, contact lenses, and other visual aids. And we can prescribe medication for certain eye diseases. So in Canada, there are only two schools of optometry. There's one in Quebec, so at University of Montreal, the one I went, and that one is in French, and they accept CEGEP and university students. And the other one is in Ontario, so University of Waterloo, and they accept university students. So only two. In the States, they have a little bit more. In Canada, only two schools. And then regarding my doctorate of optometry degree, so here in Quebec, it's a graduate program of 5 years. So once you completed that program, you have the title of Doctor of Optometry, and you can already practice in a clinic. So you don't need to do any residency or afterwards to practice. The residency is really an optional program afterwards. So how it's divided, so the first 3 years of the optometry degree, so it's very intensive courses and laboratories. We have like between 8 to 10 courses per semester. So I'm not gonna lie, it's quite intense, a lot of studying and organization. Then the 4th year, it's only courses, and you start the clinical practice, so the general optometry practice, and you also start your research project. And then on the final year, you only do clinical practice. So general practice, specialized optometry clinic, you do 3 months of an externship, either in Canada or in the States, where it's mainly focused on ocular health. And on the final year, you also have the Canadian board examination. So the huge exam that allows you to graduate from optometry school and practice. So what a day in an optometry clinic looks like. So the conventional practice in a private setting is usually you see between 8 to 14 patients per day. We usually say like, oh, from 0 to 100 years old, because we have like a large variety of patients that we see. So we do comprehensive full eye exams that last usually between 30 to 45 minutes, follow-ups, we see emergencies, exams under dilations to see the ocular health of the patient, cycloplegic drops, contact lens adaptation, driving license is very, very varied. There are also specialized clinics. So you have clinics like pediatric oriented, programs like screening with the École de la Vue, which is a government program. There's a lot of mobile clinics as well that provide healthcare services to CHSLD, residency for elders, Nunavik to the Inuit. We also have like in the picture on the corner, so that's the mobile clinic providing healthcare services towards homeless people. That's actually on the last year of optometry degree. So we go to different shelters in Montreal and provide high quality eye exam. You have ophthalmologist clinic, low vision readaptation center. So once again, you can really have a varied practice. The lifestyle in optometry is it's a high quality. You have an amazing quality of sorry, I'm repeating myself, lifestyle. The easiness of finding a job is amazing. So 100% of the students already have like a job. They already signed a contract like 2 months before graduating. So that's very, very reassuring. You have a great balance of family, work, hobbies. The average, usually optometrists, they work like 4 days a week, and you can make a good salary. It's, if I'm not mistaken, the new status around like $130,000 to $150 per year, and it goes up if you own a clinic and everything like that. So you have a very good economical stability as well. 80% of optometrists are self-employed, so you are the one in charge of like you can say like which day you want to work, from what hour to another. You can choose your own vacations, unlimited vacations. So that's the advantage of being self-employed. And then, oh my God, I talk a little bit fast. But what are the best and worst aspects of the profession? The best aspect, I would say that it's just a relationship that you can have with the patient. Because we're doing like 30 minutes eye exam, we really have the time to interact with the patient, have a discussion with them, not only because we need to know like what kind of work they do, their hobbies, their daily activities, not only to socialize with them, but also to know their visual needs, which is very important, and it's going to guide us for the eye exam. We don't do any surgeries or injections, so usually patients enjoy their time in an optometry clinic. The worst aspect, I would say that unfortunately most of the optometry clinics are private, so not all the patients can afford to do an eye exam, which is very important. Not all the patients can come every year, every 2 years to do a follow-up. So that, I would say, it's the worst part. And it's a lot better now, but in the past, people used to think that optometrists would just like prescribe glasses and make money out of it, but it's really, really not the case. We're really focusing more and more, like the profession is evolving. We're focusing a lot on ocular health, working in collaboration with ophthalmologists. So it's just, yeah, it's evolving a lot. And why did I choose this profession? So because optometry is just amazing how we can improve the quality of life of the patient. Because, you know, like sight can have like such an important impact in one's life, either work, school, or daily activities, sports. So it's so important to have like good vision and good ocular health. So it's great to be able to have a positive impact in that. You can experience immediate gratitude from the patient. Like they say that someone arrives and say that he says that he sees blurries, you're able to like put some glasses on and show them the difference. Like this is what you were seeing before, and this is what you're seeing now with corrective glasses, with contact lenses. So it's just, you have like a wow effect immediately. So that's very rewarding. Also, here I show a lot of pictures of like all my colleagues. So usually here in Quebec, we're a class of 45 students. So it's amazing, like all the bonds that you can create with your colleagues. You're with them like 5 years. So it really becomes a family. We help each other a lot. Optometry is a small world as well. So like you get to have like help from a lot of people, and you do a lot of activities as well outside of school, a lot of partying. So you study hard, but you party hard as well. And that would be it. And also, of course, like one of the best thing about the profession is, like I mentioned before, the good quality of life that you can have in the future. So that's pretty much it.
Thank you so much.
No problem.
Also, congratulations for graduating this year.
Thank you.
Some questions we have. Can you explain the difference between optometrist, optician, and like ophthalmologist?
Yes, of course. So optometrists, like I said, we really are the primary healthcare providers. So what we do the eye exam and we give the prescription of glasses. An optician, what it's going to do is going to take the prescription of corrective glasses from the optometrist, and he or she are the ones who are going to create the glasses. They're going to have the discussion with the patient, like what kind of glasses you want to have, like simple vision, progressive glasses, reading glasses. So they're going to have that discussion and also send all the results to the laboratory. Those are the opticians. So making glasses and contact lenses as well. The ophthalmologists, those they have a medical degree. So you go to med school, then you do a residency in ophthalmologist and other specializations. And they're the ones doing all the surgeries, the more intensive procedures, medication. So that's the difference.
Okay, thank you.
It's more studying.
Yeah, more studying. Someone's asking, what is the starting salary for this field?
It really, the thing about optometry is that it really depends like how many days you work per week. I would say like if usually we start at like working 4 to 5 days a week, and it would be $120,000 right now, the starting salary. Then it goes up depending on how many days you work, how many patients you see per day, because you receive a salary like it's not a fixed salary, it's very per patient that you see. So let's say an eye exam is like $100. So that $100 goes to you. So if you see like 2 patients, like 2 30-minute exam, you get like $200 in an hour. Of course, you have like the clinic takes a small percentage of it. So it really depends on the amount of patients. But I would say, 120,000 to 150,000. If you own a clinic, it goes up to 180,000. I think the highest is like 250,000.
I think a bit related to the last speaker. How comfortable do you have to be to open your own clinic? Like how many years of experience, for example? When do you feel like
1 year? Yeah. So we do have classes of like management and economy on the 4th year of optometry. But yeah, after 1 year, you're already comfortable to know like how it works, a clinic, like an optometry clinic. And some of my colleagues have taken like an MBA, but you don't need any other like degree to open your own clinic. But after 1 year, you can. Especially what's good now is that right now we have like all the baby boomers, so all the patients that Quebecers are like 60 and years and older that are taking their retirement. So that's why like there are a lot of opening spots for like if you want to become an owner, and a lot of opportunities in the next few years. Right.
Where do optometrists normally work? Do they always work with together with opticians?
Usually, yes, because normally we work in private clinics. So you're usually going to have like an optician there to be able to like sell the glasses and everything like that. That would be it. That's why, like I mentioned it in the worst part, unfortunately, it's only in private settings. We don't have optometrists yet in a hospital. There's one like working in geriatrics, but it's very rare. So yeah, it's usually private clinics.
You talked earlier about specializations. What kind of specializations are there?
So at University of Montreal, you have 5 residencies. So you have like contact lenses, pediatric, binocular vision. You have the one I'm doing, community optometry. So it's I'm specializing myself in all the mobile clinics, like going to see Indigenous people, homeless people, geriatrics. So that's community optometry. And then you have low vision. So those are the residency, like a year post-doctorate. But on the final year of the optometry degree, you do get a chance to experience different specialties. Actually, we have 15 different clinics at University of Montreal. Right now, we even have the neurology department that opens. So we see patients who have had concussions and how to manage their visual needs and everything, the visual disorders. So pediatric, geriatric, contact lens. I'm missing some. Yeah, but we have a lot of specialties. Yeah, specialties.
Someone's asking, how much money does it cost to study in order to become an optometrist?
Yeah, to study. So here in Canada is about $10,000 because you need to like per semester is about 2,000, so 4,000 a year, and you need to you have like $7,000 out of like instruments that you need to buy on the 2nd and 3rd year. So those are the most expensive things. In the States, it's a lot more. And also, sorry, I forgot to mention, like you like once you completed your optometry degree, you can even do the American Board of Optometry if you want to do a residency in the States. That's also an opportunity that you can, like a specialization in the States. They have more variety there as well. Yes.
A 2-part question that we have.
Yes.
First, would you feel comfortable taking a lot of days off for traveling? Part 1, yeah.
Well, like I said, like usually because we are self-employed, you can take a lot of day off. I would say usually optometrists take like 5 weeks off per year to go to travel, or you can even take like you can even take a whole month off. I don't feel comfortable, honestly. But yeah, I've seen some optometrists taking just a whole month and traveling a lot and then going back to work. So you don't have any limitation for that, but no.
I think that's the advantage of working in a group, like your colleagues can
exactly like the clinic where I
yeah.
work at, we are 10 optometrists, so it was super easy. Like right now I'm replacing a colleague who went to maternity leave, so yeah, there's always going to be like an optometrist to be able to replace yourself, or if anything you can always like open new spots after you come back from traveling, or yeah, it's very flexible.
Actually, are there any like people who just do replacements? Like for example, for pharmacists, some people only do replacements. Is there something similar for optometrists?
They are, yeah, we have that. And we also have, because right now there are a lot of optometrists working in Montreal, but like all the regions in Quebec are looking for optometrists as well. So you do have something that's called, like, I don't know how to say it in English, but it's optometriste volant. So let's say you go like a week, everything is paid. You go to Rouyn-Noranda, which is like 7 hours from here. So you really spend the entire week providing eye exams. You even go to Gaspésie, Sept-Îles, like all the regions in Quebec. So that's also, I don't know if I answered the question, but you have like optometriste volant, which is like you can replace some optometrists in the regions.
Yeah. And the second part of the person's question was how challenging are the studies? Something like that. Yeah.
It's quite challenging, I'm not gonna lie, especially because, like I said, you have 8 to 10 classes. So a lot of studying per classes. The way it's not like, because in med school it's like you have like you concentrate yourself in a system and then you go to another one, but in optometry you do like everything is together. You have like midterms and final exams. So it gets intense when you have like a lot of midterms, and you also have like laboratory exams. So it requires a lot of organization and time management for that. Yes,
and are there also like, sorry, go ahead.
Oh no, it's just like, because what's challenging is like not only you need to study for your exam, but also practice for your lab exam. So the laboratory at university, we have an amazing laboratory where you can practice. It's open 24 hours, so like you can go there and practice anytime. Bring someone from outside to practice, and so that's very good.
Cool. Yeah, so I wanted to ask, since you just started working, are there any differences between what you expected it would be like and what you actually experience?
Yes, they are. Well, I didn't know that optometry had like so many different options later on. Like in my head, I thought like, okay, optometrists, we prescribe glasses and we see like the ocular health and that's it. But there's so many opportunities, like different specialization. Like I was saying, like geriatrics, pediatrics. Just the thing that what I was most worried is that I thought that all the optometrists were going to work in private clinics only, but how can I explain myself? Like, let's say like the residency that I'm doing allows me to travel a lot and to see like different populations, like Indigenous people. And like, I didn't know you had that opportunity as well to do like mobile clinics. Yes.
Actually, do you have any like stories you want to share from your mobile clinics? Like patients that you were like you have a special connection with, for example, like clients, I guess, not patients.
Of course. Yeah. So we because we are going to many shelters right now. We started off like by going to 4 shelters. Now we go to 11 shelters in Montreal. We even go to a youth prison detention center with a mobile clinic. And I would say like one of the experiences that I love is just like a 50-year-old patient who developed like a very severe mature cataract and wasn't able to work. He was homeless because of the sight and other problems as well. And then we refer him for a cataract surgery. And afterwards, like, he was able to like to get into like the working place. And so you can really change someone's life.
I guess it's a lot of more vulnerable populations.
Exactly.
When you do like mobile clinics.
Yes, exactly.
Okay. And I think last question before we continue, are there some like personality traits that you find are better fit for this job, or some personality traits that would not fit for this job in your experience?
Yeah, well, like the gentleman in the last presentation was talking about, you need a lot of patience as well, especially when you have like elder patient who they're going to take a little bit more time to answer your questions or do the eye exam. So you need patience. You need time management as well, because you have like 30 minutes to do the eye exam and you don't want to get like too late. Once again, when you're working in a private clinic, some patients can get a little bit annoyed if you take too much retard, if you're late a little bit more. A lot of empathy, communication skills as well is very, very important. Like I said, like in the eye exam is so important to have good communication skill, to understand the patient's visual needs and be able to assess their needs. Yes.
Cool.
So
Thank you so much.
If you're more like a quieter person, so that's something that you can improve as well with. You have 5 years.
Well, I guess if you hate talking to people, maybe don't. If you don't want to talk to people all day, maybe don't.
Exactly. No, exactly. You're talking
yeah.
to people all day, and different kind of people, children from like 2-month-old to 105-year-old. So
or even 2-month, like people who can't talk, I guess, like two.
Oh yeah, exactly.
Yeah.
But the parents, you interact with the parents as well. So it's a lot of social interaction in optometry.
Cool. Yeah. Thank you so much for your time.
My pleasure. Thank you for having me.
Bye-bye.
Have a good night. Thank you.
Our next speaker is one of YAHPA's members. It's someone who's a physiotherapist. It's Kim Fei.
Yes. So, 大家好，你好，大家好, good evening, everyone. So I hope you guys are having a wonderful night so far. Thanks to all those speakers that came and take their time to come here to speak with us. And also, good job everyone for staying, for those who are staying all these 3 hours listening to those speakers. Thank you for your patience. So I'll talk a little bit about myself. My name is Kim Fei Hua, and I'm actually a physiotherapist full-time since 2019. I've graduated for 2 years already. And I'm working in a private clinic in Montreal. It's a Physio Extra. And yeah, full-time job since then. And at the same time, I'm also a co-founder of this association, YAHPA. So with the help of those wonderful people that you guys cannot necessarily see behind the screen, but they're working super hard with us. So yeah, this is a little bit about my background. So I think the best way to showcase you guys what does a physical therapist actually do during his daily day is with this video. So if we can just allow to open this. Excellent. So this was a video actually created during the pandemic in order to showcase a little bit the COVID measure in our clinic. So I think it's a good way to let you guys know a little bit more. So if you can play it. So at the right beginning in the clinic, we usually receive patient from an 8-hour shift. So there's a patient coming at each hour or 30 minutes, because usually assessment is 60 minutes and the treatment usually takes 30 minutes. So we usually prepare the room in order to receive them. And then we need to have a whole assessment of what is the condition. So for example, in that case, the lady is coming for a back pain. So we need to do a proper assessment subjectively. So to really understand where's the pain, how long have they been living with the pain. We'll also take many different measures with different tests and different tools in order to really clearly identify what is the issue today that brings this patient here. So we also do a lot of learning and teaching at the same time in order to let the person, the patient know a little bit what's the condition. So we really examine muscle, joints, bones. Also, we treat people at the really end also. And after the therapist understand clearly the condition, he's able at that time to start the treatment and explain to the patient the treatment plan. So yeah, and that's the really what it looks like in video. So you know, we say video means a lot of words, but for some people also, we can go to the next slide, please. maybe in words also. So maybe some of you guys are less visual, or maybe more need words. We have a definition from the world of physiotherapy, which define a physiotherapist provides services that develop, maintain, and restore people's maximum movement and functional ability. So in other words, if you're having difficulty moving, then you should come see a physiotherapist. And also they continue by saying they can help people at any stage of life. So as you guys can see, we really treat at a level of pediatric field and adult and also elderly. So in each of these conditions, in each of this step of life, we're able to help these people. Different settings also at the same time. So we can go in, we can find physiotherapists working in hospital, rehab center, CHSLD, CLSA, private clinic, and schools also. And in those different stages of life, there's possibility that people have movement and function that are threatened by aging, injury, disease, and disorder. So what are these? For example, you can go to the next slide. It can be like orthopedic level. If someone come up with a sprain or a fracture or a post-fracture more, and also people after certain orthopedic surgery like knee replacement or hips replacements. This is a field that we can work with. Also, we have the neurological system. So if a patient has had, unfortunately, a stroke or any spinal cord injury, they have the movement limited. So we can really help them to regain it and restore it. Also, we have the cardiorespiratory system, which is maybe a field that is less known, but very quite important also at the same time. It will be with people that had heart surgery or lung surgery, or that, especially right now in COVID and pandemic situation, physiotherapists are really helping them with giving some breathing exercise and a lot of different techniques that help them. And other domain of practice we're talking about, it's we're talking about sport and physio, but we also have amputee, and we also have vestibular rehabilitation, which is one of my specialty, which is people that consult for dizziness or any type of vertigo. We have proper assessment and assessment tools in order to assess and treat. Lastly, in the definition, physiotherapy helps people maximize their quality of life, looking at physical, psychological, emotional, and social well-being. So in other words, we can also say that if doctors save lives, then a physiotherapist make it worth living again. Next, please. So you might ask yourself now, how long are the studies? It's actually a bachelor-master continuum, which take about 4.5 years to complete. We're talking about a Bachelor of Science, which takes 3 years, and a Master of Science, about 1.5 years to complete. So here's those different university, 5 different institutions in Quebec that you're able to have those classes. Next, please. So this is, I think there's maybe a bug in the PowerPoint. Is it possible? We can come back. Yeah, okay. So that's just a little picture, so you guys know a little bit what in the practice in the university look like. Like we have a lot of theory class, but we also have a lot of practical class. So we usually practice between colleagues, and the teacher usually stand in the middle of the room and showcase all of those tests, all of those different techniques. And yeah, just a little bit small sneak peek if you decide to go study in this field. Next, please. Next, we also have the physiotherapy technologist. This is actually a job that a career path that is also related to physiotherapy. It's a diploma of college studies in technique that takes 3 years. And these are really like the sidekick of the physiotherapist. So we usually work a lot together. And for example, we might be doing in private clinic some assessment, and those technologists will continue treatment with them after that. So there's also different CEGEP that offer this program. Next, please. So another question will be, will I find a job? So this is a really good question that usually I will say it's super easy to find a job in physiotherapy. It's in high demand. You can find it either in the private sector, but also in the public sector, as you guys just see before. Especially right now, there's a lot of demands, and usually, like if I talk for myself, when I graduated, actually 2 months before I graduated, I already had a job. So this is that in demand that usually private clinic rush into you to give you job, either than you go out to look for job. So this is yeah. Next, please. So if I explain a little bit why I chose PT, for myself, it was really starting from CEGEP. When I took those biology class, I realized that I really have a big passion for everything that's related to muscle, bones, joints, nerve system, vascular system. I was super interested, and at the same time, I really wanted something that is a handful for me, that I can be able to help out people that is surrounding surrounding me. For example, family or friends. If they have any pain at a certain place, I can quickly know a little bit what's happening. And at the same time, I had this big important values, which is to help people. So I put those two things together. It becomes my choice of career path. Next, please. So now we're gonna go with the pros and the cons. About the pros is, like I just said, you are quite useful and quite quickly also, because I mean, it's not super quick, 4.5 years, but still it's a average amount of study, so you can finish quite fast and be able to help out. You can make also difference in people's lives. Also at the same time, you can see a patient progression, like a patient that consult at the beginning with he doesn't understand his condition. Then after the assessment, you are clearly understanding the treatment, and you can explain a little bit better and treat at the same time. It's also a very stimulating job, so not repetitive at all, because each patient comes with his own background and his own. So 2 sprained ankle won't be the same ankle to treat. So this is also an interesting thing. Quality time with patients. So like a little bit like Bianca, the chiropractor said, we have a lot of time with our patient. Like we talk a lot. We treat. Usually, you treat, you will talk with your patient. So you also develop some good relationship with them. There's also a lot of business opportunities. Like for example, myself, I'm working as an employee. But if you guys have like any, you want to be self-employed, it's possible, and to also open your own clinic, it's also something possible. Schedule-wise, once again, it will also depend the level of stress also. It's because it depends on what field will you be practicing in. So if you're working in the public sector, you might have a more fixed schedule, but in private also you have fixed schedule, but you do have sometime maybe a patient who's not coming in. So so there's also a lot of variation at the same time. Level of stress also the same time. Same thing, sorry. Another pros is that there's a various field, like I just explained. So if you guys, for example, don't feel like after 5 years of practice in private, you feel that you have enough of private, you can decide to go in public field. And once again, you will certainly have a job at the end. Next slide, please. Now, with the cons, I will also say that maybe you might be too useful. So why I say that is because if, for example, families or friends know that you're physiotherapists, at some point they will certainly ask you, oh, I have this pain here. What is happening? Can you treat me? So this also might be a little bit a con part. There's also maybe too many job opportunities. You guys can maybe find yourself in shoes that you don't know where exactly to go. In private clinic, because this is where I practice, performances is also sometimes needed. Because usually you're paid by patient, right? So if your patient doesn't show up, then you find yourself with a time gap that you usually not pay for that. And also depending of which clinic you're working with. Sometimes the directors of the clinic can give you a little bit of stress on that, but usually it's not the case. The complexity of the human body. So for some cases, it can be easy to assess and treat, but from some other cases, it can be also quite complex. So it should be in the therapist's job to identify if it's in his field that he can help this person. If not, he should refer to someone else. I'm talking also cons as for the customer service, because once again, sometimes you do want the patient to come back in order to have a proper treatment plan that is respected, because usually we give a lot of exercise for patient to do, and not all patients love to do exercise. So this is also maybe a harder part. So sometimes you need to answer the patient's what he really wants. So this is all about the customer service. Salary rise, I wasn't sure if I should put it here or in the pros at the same time, because in private sector, you have a lot of competition. You can always have competitive salary to request. But at the same time, if I compare the salary of a physiotherapist to, for example, a doctor or optometrist, or just say dentist, pharmacist, maybe this profession will have a higher salary than a physiotherapist. However, once again, if you decide to be self-employed or you decide to have more patients, to see more patients in a day, you're still able to have a good salary. But at the same time, good and bad, you always depend on what you feel. I do believe that you're very comfortable when you work you work as a physiotherapist. You can also work 4 days a week. It's possible. And finally, schedule level stress, a little bit like I've explained. It really depends on where you'll be working in. So next, please. And this will be the resource that I've used for this presentation. So if you guys have any question or anything, just let me know, and it will be a pleasure for me to answer you. Thank you. So is there any question?
Thank you so much. First question. So I don't know if it's a myth or not, but is PT very physically exerting? Or are there some way to practice that it's not as physically demanding?
So maybe what I will say for that, it depends on which area you're working in. Some it will be maybe more, and some part less. For example, in my case, in private clinic, sometimes people would think, oh, it's very physical. But to be honest, it's not at all. At the end of the day, I'm not physically tired, but I'm more mentally tired, because you need to do a lot of clinical reasoning. Why I say it's not tiring, because you're always changing position. This is the best thing I will say, because sometimes you might be working on a leg, which is a small part. Sometimes you may be working on the lumbar, the back, but sometimes you can work with just the hand, because we're a specialist in all the human body area. We're able to really change. So each day it's different. And I will say that in our classes, we do learn the proper ergonomical techniques to use. And at the same time, if you want to be a physical therapist for a long period of time, you need to care about your own body. So I will say at the end, it's more benefit for me, I do believe, because all the patients that I'm seeing most of the time, especially right now during the pandemic, is actually people who is not moving. So we have, for example, people who's working from home, where they're sitting 6, 7, 8 hours in front of the computer, and they actually have more problem than I do. So at the end of the day, movement does help, and I believe it's not an issue.
Can you tell us an example of a problem the patient can come with, a problem the client can come with, and what kind of intervention you're going to do? Like a concrete example of something. Someone walks in.
Yeah. Like if we take the example of the back pain, right? If it's a back pain that is really minor, like for example, someone like he's sitting too long in front of his computer and he's complaining about those back pain, I will usually take the assessment first to see if it's any dangerous. If it's not dangerous, then usually it can be like only dysfunction, lumbar dysfunction, that, or maybe muscle who's not working strong enough. So what we will do in that case, we will start the treatment by, for example, working on those muscles who are too tense. And after that, we can see some vertebra, some part of the joints of the back, which is a little bit more stiff. We can work on that with our hands, or we can use also electrotherapy, which is a different, it's a different tools that we can use in order to stimulate or to reduce some tension in the muscle. But we can also, and usually the most important is that we give exercise and recommendation. So we do talk a lot during the day, because we do give recommendation. For example, people to not sitting too long. At each hour, they should stand up, and they should also do exercise. So we usually show them some specific exercise for his back area. So yeah, this can be a little bit more concrete.
Yeah, thanks. An interesting question. Is this job suitable for a female?
Absolutely. I will actually, you know what? For example, in university, there is a high percentage of women and less of men's. Like I will usually easily say like 75 or 80% is women, and like 15 to 10 is men. So yeah, so once again, there's a lot of women. And actually in my clinic, we are 7 therapists, physiotherapists, and we're only 2 men. So you can already know a little bit.
Someone's asking, what's the difference between physio and PT?
It's the same thing. Is a physiotherapist, physio, and PT is a physical therapist. It's just the same thing.
And maybe last question before we continue. Since you became a physiotherapist, did you become very self-conscious of your own posture?
Absolutely, yes. Absolutely, yes. It's so important, because you will feel it if not at the end of the day. And you do know that something went wrong. And at the same time, it's because you always tell your patient to stand straight. You cannot yourself introduce the patient with the bent back. So I do have a big mindfulness of my own posture. And this is even daily, in my daily life, not only during the clinic time.
Sounds like a very healthy profession to pursue. Yeah.
It is. Encourage you guys.
Thank you very much. It was very interesting. If you have any questions, you can message us on any of our social media. Oh, well, last question before we continue. Can PT treat osteoarthritis?
Yeah. Usually osteoarthritis is a degenerative condition. So we cannot treat them in the way that it's not curable completely. But what we can do is really to work in order to reduce and to control the degenerations of the cartilage. So it means that we only work on making sure the muscle are strong and making sure that the muscle are flexible enough and also a good mobility, so that people can really continue using it without continue having too much pain. So it's really more a control level than a treatment level.
You can leave your clinic information below if anyone wants to consult for arthritis.
Absolutely, yeah. Thank you.
Okay, good. So that ends the speaker part of our event. Next up, we have a message from our sponsor, Collège Elite. So we have Mr. Zhao here. Yeah.
Hello, hi, how are you?
Good, thank you.
Hi, Natalie, how are you? Thank you. So you put a slide?
Sorry, I didn't hear you.
Okay, you have the slide, right?
Someone else is doing the slides. Maybe.
Okay, okay, you can.
Yeah, they can show. Yeah.
Okay, thank you so much. Okay, thanks a lot for the YAHPA to give me the opportunity to say something in this important event. And firstly, when I heard the news, I was really happy to know that there is an organization doing some job, which I think is very, very important. Brief introduction for myself, I'm Bradley Zhao, and I'm the president of the Elite College, which is founded in 2004, which is around 18 years in education for the teenagers and the young adults in Quebec. Actually, we have students from like even Quebec City. Now, because it's online course, we have like other provinces too. I'm also the recipient of the Senate 150-year anniversary medal award. For this opportunity, I would like to, next slide. Oh. Actually, yeah, actually, because we want to find ourselves, like for the question is like, if we want to do something for the future and find the way to the future, what is the best and the suitable choice for us? So I believe that most of the students who are attending this meeting are facing the choice of direction for the future, the career path also for your life even. As for CEGEP, you are choosing your first program for your career, and as a university student, you are discovering a new path maybe. Next slide. So for this purpose, you should know what is the possibility are and how you can discover. Firstly, like you can join the workshops like the YAHPA hosted today and last week, which is very, very successful. And the 13 speakers really did an excellent job. So we know a brief of each of the fields, which we are not limited only for the medicine and the dentist, because there is so many fields is related and it's so good for our, if we get a chance and we like. So also we have the education fair every year. So you can join it. Usually it's by the CEGEPs, and you can see what they are doing indeed. Then you maybe, if you like, you can make a choice. And usually the schools, they have the academic consultant, which is like from secondary level, from the CEGEP level, even university level. They will give you some ideas, which is very important and is very useful. And study for a day, student for a day, which is offered some by the CEGEPs, maybe some university also. That is like, okay, the computer science or like the medical science or like dentist, maybe you have the chance to know some. And the volunteering is very important. Many of the students, they say, oh, how can I get the volunteering like in the hospital? Anything maybe you can do. Like even I know one of the students delivering the newspaper for the hospital. That's also good. At least you get a chance to know how it works and how the patient, how the doctors, how the nurses doing. So it's, then you maybe later on you get more other chances. That's good. And also visit some professional institutes, which also is good, but sometimes you are limited to the chance to do it and shadowing. Next slide. Actually, this one I made. It should be another. This one, the secondary. Who could be involved in the procedure, which I forget to update it. This should be 3 parts mainly. For choose usually yourself and your parents and your close friends. What I know that usually some student who want to do it by himself, but sometimes the parents give a lot of advice, sometimes pressure, because it's a different generation. There is a different view, different point of view for the future and for the careers. As I know that one of my students who is graduated from the Jean de Brebeuf, and she really likes the biology, but the parents, have a different opinion, and they even now they are not still understand each other. But now I tell them, you should respect each other. Also, close friends sometimes give you some ideas because they like the certain speakers, like your friends, they give you some idea about what they are doing. That's very important. Next slide. Next slide. Yeah, certainly, whether we choose income, high income or low income, no, not choosing low income, and also our own portion. One portion is the firstly, actually, like my last slide will say the ability. So if you are really, you have the ability, you can you can have the good R score, then you can choose a certain level of the study or the field of the study. Usually the medicine and the dentistry, they need to be quite high R scores in the CEGEP. And also, this is one side, but also money is important. Money is nothing, but it's very important. Also, it's something, because if there is too much money, not necessary, but if there's no money, it's a problem. So the income also is very important. But this now is balanced between the previous slide. The parents may be more concerned about the money, the income, but for youngs, you may, your own preference. Sometimes, some people, they doing a certain field, maybe the parents really don't like, but I usually advise them try to make the compromise between the 2 generations, like parents and their kids, because it's, if it's only for for parents, if you give them the kids too much pressure, also is no good. But the kids, if they do something which they don't like, also is not so good. So we try to compromise. But finally, I hope the parents can respect the youngs and let them to do whatever they like. That is very important, because I always get some calls. Sometimes say, hey, Bradley, could you advise my son or my daughter? I don't want what she wants to learn. Can you advise her that we want her to do what? So I said, finally, usually I have them, okay, we try to respect your kids, because they are the one who will do it as their life. So it's needed to be respected. Next slide. Okay, then if you get a chance, you have the ability and you make the choice, then you need to see, do you are ready to take the challenge for the selection? Because many fields are really, really stressful, and some are maybe a little bit easy going, and also some fields, they need more years to study, and especially you want to be a family doctor or something, you need a longer time to have pursue your career. And also regarding your own personality, whether it's good for this field. If you are in the certain personality, maybe it's good to choose another field. Maybe it's better than the field you are choosing now. So you maybe make adjustments. That's regarding your own, but also personality compromise with your passion, because if you like it and you feel you are not so good, but you try to make it suitable for this field, then you might do something possible to do something like for your life. You are really you will feel happy. Next slide. Okay, this is I just want to tell advice, and share this idea to the audience for today. Actually, the fundamental teaching of the Confucius listed 8 things that great learner should do. So it's a sort of proverb of Chinese proverb, and it really means that before you want to do something like make a good career and you do something, make more contribution to society, you need really investigate the nature of the things. That's important. Then pursue the knowledge, and you have that. That's why I say the ability and acting a good faith. Then rectify one's mind. Also, this is important. Then after that, then you can culture your moral character and manage your household. Then you can come to the further level, like state affairs and bring peace to the nation. It's sort of like not really it's a nation or like state. It's really is regarding like even your certain field. In this field, firstly you do something. Then like the YAHPA do now, they organize and try to do something in another level. Then maybe you manage a company, like in the speaker said, many of them maybe open their own company. Then whether you can make the company good, profit, and also helpful for the people, then and you feel happy also. That is really a sort of balance. Then in the very good level, you will every side is harmonious and everything is good from the like your client and yourself and your profit and your services. Then you come to the quite good top level. Next slide. So those are just like few recommendations for the students. And choosing a direction of the first step is of discovering the society. In the future, please keep being curious in discovering new things, acting a good faith, and be dedicated to the community. So what today the YAHPA did also is somehow like helping, not only they did well, but they are helping the people. Also the speakers are really did very good. At the end, I would like to wish everyone good luck in your future study and a bright, happy life. And really appreciate the YAHPA, the team. They make a very, very good organization for the event. And also all the speakers, they spend a lot of time and made excellent presentations for the event. Thank you so much.
Yeah, thank you so much.
Thank you.
Thank you for the wise words and the excellent advice. And thank you to all the speakers who came, who gave their time, who volunteered to be here. I hope it was helpful to like open your I guess make you discover new things and help you in your future career choice. If you have any questions or comments about today's conference, leave them in the comments or message us on the social media. And don't forget to complete the survey we have. We'll send you. So thank you everyone, and especially to our sponsor, Elite College.
Thank you, Natalie. Thank you, everybody.
Bye-bye.
Bye-bye.